So we have, first off, as we're familiar with, kind of Tylenol, Motrin that we can use for the treatment of fever as far as medications are concerned. And we do have a nice, when families come to the office, kind of nice chart and stuff that we are able to provide to you based on the weight, kind of what the correct dose, because a lot of times I do see too that sometimes kiddos are underdosed, and that's why their fevers aren't being kind of maybe as well controlled. And so it's important about the dosing first off.
So we'll be posting a dosage chart on the website.
It's confusing sometimes for parents, because I have parents that come with a newborn and we say, okay, for vaccine purposes, let's give some Tylenol this much, and then the child is already a year old and they still have the same dose, and so it may not be enough, you may not be touching them. So it's important to have this chart in the refrigerator so you know exactly what to give, and always make sure that the concentration that you have is the concentration that is on the chart. They still have the infant Tylenol drops around, some pharmacies still have them, and the concentration is very, very high. And so if you measure, 1 teaspoon of that high concentrated drops, it can be an overdose. So always make sure the Tylenol, the one that circulates the most, is the 160 milligrams per 5 ml. But the infant drops, the old infant drops, are 80 milligrams per 0.8 ml. And so just make sure, most of you are going to have the 160 per 5. And then this chart that we are providing will tell you how much exactly to give. The same thing with Motrin, they have the infant drops and they have the adult, the older child.
And
doses.
no child under the age of 6 months should get ibuprofen, which is Motrin or Advil. It's 6 months and older.
Right.
Another rule of thumb is no child under the age of 18 should get aspirin.
Right.
Because of Reye syndrome, so avoid aspirin.
Yes.
And also the Tylenol comes in different preparations. Some parents are wondering that, they don't like the liquid at all, so there's the meltable one. A lot of parents are not aware that there is the rectal form of suppositories that the child can be treated with if they're throwing up or however. So that can come in pretty handy too for them. So that's good information to keep in the back of their head.